Sister Louisa Abid is a member of the Sisters of St. Therese, one of the largest congregations of sisters providing health services to vulnerable communities in Cameroon. She is a registered nurse with over 15 years experience managing healthcare projects in the country. With sponsorship from MFH, Sister Louisa successfully graduated with a Master's in Public Health from the People's University in Leicester, UK. And she's currently the health coordinator of the Archdiocese of Bamenda and is also the point person on the health for the ecclesiastical province of Bamenda. Sister Louisa, welcome, and thank you so much for taking time to be here with us today.
Thank you, Margaret. It's a pleasure joining this meeting this morning. I'm happy to be here and to talk with you about our working relationship with Medicines for Humanity. I've been working with Medicines for Humanity since 2014, and it's been a very helpful working relationship. Presently, we are running a project titled Strengthening the Capacity of Congregation of Women Religious to Improve Child and Maternal Health in Cameroon. We are running this program in 6 sites here in the Archdiocese of Bamenda, 4 sites that are under the Archdiocese and 2 sites that are under Ginicom Hospital. Medicines for Humanity, working with us, with the women and the children, have also been by us in the advent of COVID. When the COVID started, Medicines for Humanity were the first people who donated us materials for sensitization, materials for protection and prevention, and even medications to prevent COVID. It was very exciting because we had heard about COVID. We had read from the media, we heard on the media, we read, but you can never trust anything that you see on the media. And so it was very challenging for us to even do sensitization because you were not too sure whether what you will be saying is the correct thing. But when we got the educational materials on Medicines for Humanity, we were very confident that whatever we will be telling the people is what we can have some backing. And so immediately we used those materials, we used the training manual to organize a training session for healthcare managers. We have 25 health facilities, and so the healthcare managers all assembled, and we gave them a training on the preventive measures, on management and protective measures. And so they now went back to their health facilities and they had a step-down training with their community health workers, with their own staff of the different health facilities. And the community health workers now took the message to the communities. You know, thanks to Medicines for Humanity, they also gave us megaphones. And so they used that in the communities and they blew the trumpet and they told the people, they gave the people the message about COVID-19, and everybody was aware. And people were hearing, some people were hearing for the first time, and it was more, it made more meaning because when they came out to the health facilities, they saw buckets, they were being given masks, they were being asked to wash their hands, and they really felt that this was serious because that was the first of its kind. The government had not done anything as yet. And so it was the impact that Medicines for Humanity created that gave a lot of awareness to our people. And talking about the effects of COVID-19 amongst our people here, people are living in a lot of fear, in a lot of pain, because for Bamenda in particular, for the past 4 years, we've been experiencing an armed war. If for those who don't know, there has been an Anglophone crisis in this region, the Northwest and the Southwest region, that has resulted to a lot of killings and displacement. People have displaced internally and even externally. So we have people who are within the town who do not even have a home, do not have shelter. And imagine these people who are struggling to find shelter, who have abandoned their homes and they are struggling to survive in town, and then they are now infected with COVID. And maybe in a room, in a home, in a household, there are about 8, 10 of them. If one person is infected, definitely all of them are infected. And then it comes that they have to be isolated. So they don't have to go anywhere. How will they feed? How would they take care of other basic needs? It has really been a problem. And there is a challenge of people being afraid even to go to the hospitals because they are afraid that they will be tested positive. And the consequences for them, they don't see it positive that if you are tested positive, then you will take treatment and you get well. The fear of being taken away, the fear of dying. So people just prefer sometimes just to stay. But the good news is that most people came to our Kali Health facilities because they believe that at least in our Kali Health facilities, they will be given the true results. So within this time, we are having more patients in our Kali Health facilities than the government, the public health facilities. And we have situations of people here, people do put on masks, but not properly. But in the health facilities, we insist all the people, anybody coming to the health facility, you must put on your mask. The staff, the health personnel, they were also challenged when they were infected. We had a few, early May, we had a few staff members that were infected, and this caused a lot of panic among the staff members because it was like, oh, so we too, we are exposed to this. We can also be infected. But they didn't run away. It was an eye-opening for us to fortify precautionary measures. They are putting on the staff work, putting on their masks, and since we have a triage center to separate the triage point to separate the patients, the risk is reduced for the staff who have to be in contact with the patients almost at every moment. But the challenge still comes because sometimes the health personnel they forget to maintain the distancing, they forget that the, 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 the patient, they don't have to go too close to the patients. So it's very challenging. You need to remind them sometimes that, hey, you know, we are in COVID. So even though you have to take care of the patient, you still have to take care of yourself. Must say that working with Medicines for Humanity has been a wonderful experience. A lot of lives have been saved. A lot of women, because fighting for maternal health has been a target, and I think that all that we have been doing has really helped women, has saved lives. And all the things that we gave out to the people and what we are doing, the sensitization, because we even did sensitization over the media. We got the regional delegation for public health who came to the Kali radio station a number of times to sensitize the people on COVID, and this was sponsored by Medicines for Humanity. And we also gave out sensitization materials to the regional delegation of public health, which were distributed to all the districts in the Northwest region. And I think that the impact of it, we cannot even measure. I want to thank Medicines for Humanity for the great work that they are doing. I want to thank them especially for the sense of need. They are able to feel the needs of others because we didn't ask them for sensitization materials. We needed the materials. We didn't know where to get them, but I just got this call one afternoon from Madame Olivia telling me, sister, we'll have some sensitization materials for you people and some PPE. I said, what? Can that be true? And she said, right away, I'm sending them to you. And we got them. And we have been working with them. And we have them even in our schools. Because when we were about reopening the schools, we needed to prepare the schools and the students for COVID, especially the schools resumed for those who were examination classes. So we had the posters all in the schools, all our schools here in Bamenda, we have the posters there. And it's been very helpful. Thank you so much for all those who are at the head of organizing activities for Medicines for Humanity. We are grateful. And I also want to thank our country coordinators here, Olivia and Kenneth, because they are doing a wonderful job. They are representing you also well. Thank you.
Thank you so much, Sister Louisa. And I think really it's incumbent upon us to thank you for your tremendous efforts. You're on the ground on a daily basis, having to, you know, deal with the COVID pandemic, and you're at the forefront, and you're making such a big difference in the lives of so many. So really, we just admire you so much, and we're thankful that we're able to work with you in this capacity. So we've got a few questions, and let's get started. Someone is asking, you know, given what's going on and the infections that your staff have experienced, how are their spirits and how is their resiliency around COVID? What is that like?
Okay. Initially, everybody was afraid. The staff, they were afraid. But the good news is when those who were infected got well and they came back, they were more aware. And the fact that they got well was a lot of encouragement for others. And then when the staff were infected, we realized, we tried to close the gaps that could have exposed them. And so everybody was reassured, and everybody feels like even if I'm infected because I want to save for life, they are sure that they will get well because all those who were infected, they are all well and they are back at work. So they are not discouraged.
Okay, great, great. Could you speak a little bit to the issue of children in your communities? I mean, first of all, are children going to school? Are they fearful of the disease? And how are they affected by COVID? And are there any things being done to help support kids during this time?
Um, Children, first of all, children don't go to school. Our kids don't go to school. They are expected to stay home. They cannot go out to play with friends. In our settings here, children don't have toys at home, so the only medium for them to play is to go out with friends. But
Mhm.
with COVID, they can't go out to play. They can't visit friends. They can't go to church. Those were the places that children will always like to go, but they can't go. And so children don't feel happy.
Mm.
They don't feel happy that they are locked in. Often you see parents saying that I have to run away to find my way out because the children will not let me go out. They want to come with me.
Mhm.
And I must say that the I don't know how woman there is really no support for the children because no attention is being given to the children, especially the children in homes where parents have been infected or siblings infected, and all they just know is that you cannot see uncle, you cannot see mama because mama has COVID. The children know, they know there is a disease called COVID. There's they call it coronavirus. They say there is coronavirus has infected my mother, so I can't see my mother, and it's very painful. And
Mm.
then for those who have lost parents and they were not even able to see to go through the burial process, it is even worse. And so I know that the children are highly traumatized, but for now, I don't think that we've gotten into any activity to help the children.
Okay.